Now it's my great pleasure to hand over to Lisa Marris. Lisa is a head of research at Cibyl and is going to tell you more about the study. So thank you for joining us today.
Thank you, Hugh, and thank you, Simon, as well. So yes, I am the head of research at Cibyl, and as Simon mentioned earlier, Cibyl is part of the GTI group. So, you know, there's Target Connect, Target Jobs, Grad Island, but within that also Cibyl. So what Cibyl do is we are kind of a leading market research agency focused on school students and university students about, you know, essentially career aspirations, motivations, but also just general experts in how they think and feel. So with that, we run several different annual studies. So school leaver, graduate in the UK or as an island. But, you know, we also wanted to get involved in other areas of research outside of careers. And that's why we've kind of started on the mental health as well. And that's obviously what I'm going to be talking about today. So I'm going to run through the methodology and sample behind the report, look at the kind of student mental health outcomes that were shown, look at how university life is impacted by this, the university support that they can provide with mental health, and then that kind of transition from university life to kind of graduate working life and how that kind of all ties in with mental health. And finally, some key takeaways. So if I start off with methodology and sample, so with this, like with everything, we partner and we have our main partners, but we also had university partners, and they really helped us kind of reach a wide range of kind of university students. And with that, we managed to get over 12,000 respondents from 147 different universities. So that's essentially across the UK. And that's important because it means that we have that kind of regional breadth. It's not just one area, we're looking at collectively the whole of the UK. With that, we do also weight by university. And what I mean by that is we think about the kind of population spread of students, and we want to make that representative in our sample too. So essentially, the kind of data that we're kind of showing reflects the actual kind of representative population of students. We also weight by gender, and we do that because sort of market research-wide trend that females study kind of fill in surveys more than males, and so we also wanted to account for that. Something that I should also really point out is when we conducted the survey, and that's November to February, so essentially last Christmas. And that's important to remember because during that time, COVID was still very much on the news every day. People were worrying about if they were going to still have Christmas with their families, etc. So that was the climate of the kind of fieldwork phase, and that is what's reflected in our survey. So as Simon mentioned, the kind of Ukraine crisis, the energy crisis, the cost of living crisis, that isn't covered in this survey. That will be covered in kind of next year's survey. So who did we ask? We asked kind of current students, so about most of our sample is current students, 90%, but we have 10% the sample is from kind of graduates. So we do also have that kind of journey from students to kind of graduates. Like I said, we weighted the sample by gender, so about 54% are female. That is sort of the kind of around the proportion of university students that are female. The rest are male, non-binary, prefer to use their own term, prefer not to say. In terms of ethnicity, about half the sample is white, the rest are Black, Asian, other ethnicities, or kind of mixed multiple ethnicities. About 20% are LGBTQ+. So if you've got a sample of 12,000 and 20% LGBTQ+, that means you can have like a really good data cuts that can give really insightful insights for that kind of student group as well. Similarly, with high and low socioeconomic, about 8% are high, 20% are low, and then about a quarter were disabled. And again, that is quite a good representation. It means we can have quite good robust data from them too. I should say disabled covers not just mental health, but also other kind of mental impairment disabilities as well as physical disabilities. But I'll go now. That's kind of all the background and the methodology, but what were the actual results? And one of the things we did is obviously we measured student mental health outcomes. And so we got this figure of about 4 in 5 students have experienced some sort of mental health difficulties in the last year. And what do we mean by that? So we kind of measured that in 4 different ways. So they've kind of experienced some sort of negative thinking or behavior in the last year, experienced some suicidal feelings at some point. They've experienced mental health difficulties in the past or are currently experiencing mental health difficulties. So if they have said one of those things, we kind of categorize them as being touched by mental health at some point. And that is what I'm going to be focusing on for this presentation. But really, what are the biggest impacts around mental well-being? And it's things like worrying about not being good enough, trouble concentrating, trouble sleeping. The majority of students who have been touched in mental health in some way say that they are kind of affected by all these things, much more so than students that haven't been impacted by mental health. So what causes this mental health? Is it COVID? Like I said, Christmas last year, you know, COVID was on everyone's mind. And yes, COVID, by and large, did affect students' mental health. About 3 in 4 students said that COVID affected their mental health in a kind of negative way. Although what is important to point out is when we kind of measured this year on year, about 1 in 5 students said it had no impact at all, and that was actually more than proportionally anyway than last year. So yes, COVID was having an impact, but kind of impacting fewer students, proportionally fewer students than the year before. And I think that kind of trends with the year before. COVID was kind of a lot more of a problem in the sense that there was like furlough going on, less so the following year. And I think maybe in future years, we'll see that too, that other things will be having an impact. And so again, this is thinking about changing times, changing climates can impact mental health in different ways. But what about the other things that are impacted by students' mental health or mental well-being? Friendship, loneliness, general happiness. These are all things that kind of make up kind of your overall general well-being, and they all impact students' mental health. You can see that students touched by mental health are proportionally more likely to say that they don't have any true friends at university, that they feel lonely daily, weekly, or monthly, so relatively frequency, and also that they generally have low happiness, so scored 0 to 5 on a scale of 0 to 10 on kind of happiness. So essentially, the kind of links of how kind of happy you are, how kind of community you feel like, can also impact students' mental well-being. Another thing that's really important to mention, and Simon also touched on this, is that different student groups kind of say that they are impacted kind of more or less. So if you look at LGBTQ plus and disabled students specifically, almost all of those students, the majority of those students, say that they've been impacted by mental health in some way. So that's really, really quite high, and much higher than that kind of average. That kind of average is seen by that total grey dotted line there. There are other student groups that are also higher than that line, so females, white students as well, low socioeconomic students as well. But I think what's also interesting is the students that are under that kind of average. So the males, the Black and the Asian students, proportionally fewer of those students say that they're impacted by mental health than kind of the average. And I think what's kind of really interesting about that is when we ask students, okay, well, who have you spoken to about your mental well-being in some capacity? And those males, Black students, Asian students, proportionally more of them said that they haven't spoken to anyone at all. So there's sort of a link there between, you know, are they speaking about it, and do they feel that they've been, or saying in a survey anyway, that they've been impacting them. So this is how much of this does this link with, you know, if they're talking about it, they're aware about it, they're more kind of in touch with their mental health, or are they just not talking about it because genuinely they think their mental health is fine. So there's kind of a link to that there. In general, what we find the kind of students with a mental health disability and LGBTQ+, so those student groups that kind of majority of those students had an impact on mental health, they talk to people the most about it. And so again, that is that link there. When we think about who specifically they're talking to, it's someone close to them, so a friend, a partner, a colleague, family member, or even university's wellbeing services. That's kind of who they're talking to in general. And that sort of links me to the next section, which is university life. So, you know, they're really close to their friends. Do they make friends at university? How does university life in general affect people's mental health? And what we saw is that actually university does have an impact, a negative impact on students' well-being. So about 2 in 5 students said that their mental health has declined since starting university, and about a third said that they were diagnosed with anxiety at university. So I should note that anxiety and depressed is the people who have been diagnosed at university. When you look at overall how many students are just generally anxious, it is a lot higher. But this here is linking with how has specifically university and university life kind of impacted their anxiety, their mental health. About half of students, proportionally more than last year anyway, said that they'd taken time off, so because of their mental health. So that's also having an impact. It's having an impact on what they can do. It's having an impact on kind of their studying time. But it has predominantly only been a couple of days. So, yes, it's having an impact, but hardly anyone is actually taking kind of a year out or having to drop out of uni altogether. Or almost half, so just under half, say that they've never taken any time out at all. So that's also quite a large proportion. So yes, people are being impacted. We saw that 4 in 5 students were being impacted by mental health, but not all of those people are then having to take time off as well. But what about the student journey? So as you start, you're in first year, you have certain worries. Can I make friends? Do I know where to go, etc. The middle years, maybe a bit more settled, but more pressures on the kind of working life. Final years, you've got those final year exams, there's dissertations coming up, and you can see that that actually does also impact the mental health. So as students move through university, the proportion of students in that group saying that they have mental health challenges does increase. We also find that undergrads and PhD students, out of collectively the kind of course type, also have a kind of a higher mental health difficulties proportionally than kind of master's students. And so why I'm raising this is to think about, well, different student groups have different challenges, and therefore kind of can be affected in their kind of mental well-being in different ways. And you can see that on this slide. So this is where I compare first year students and final year students. And what we find is final year students worry about not being good enough. They worry about exams or other key deadlines, proportionally more than first years. They worry about finding a job proportionally more than first years. So this is thinking about specific student groups at their specific journey, at a specific time, have specific worries, and then kind of you can then think about how to support those students and help them with their mental health in kind of a tailored approach to them. And that's sort of what leads me onto my next section, which is thinking about university support. So when we ask students, well, when you're thinking about choosing that university, going to university, how important is having a really robust mental health provision? And just under half of students, 46% of students this year said that it was really, really important. And that's more than last year. So the kind of increasing onus on this. Don't know how much this is tied into the fact that there's more awareness about mental health, more students are kind of thinking about mental health. It is a pandemic. A lot of people were kind of struggling, but that is what we saw in our data. We do, however, found that half of students think that their university supports people with mental health difficulties, well. So it's important to them. Half of students think that also actually what the university is providing is great. However, when we looked at COVID specifically, it's only about 2 in 5 students that said that they had effective actions. So what this is saying is students find it's really important. About half of students think it's, they are providing the support that they need, but maybe not actually nailing the kind of COVID support. And so again, this is thinking about, well, how can universities react to the times, react to kind of the challenges of the times? Last year was COVID, this year it's going to be all these other cost of living crisis. How can students effectively react to those and help kind of support students? When we ask students what they prefer in terms of support, just practically on a kind of online versus virtual, about half of students say in person, that is the kind of preferred option. About 20% or about 17%, about 1 in 5 say online, and the rest sort of don't really have any preference. But I think what's interesting between the in-person and online preferences is what they get out of it. So in person, it's this feeling that, more personal, more approachable, more effective. Whereas people who prefer online, they say it's things like accessible and convenient. So this is thinking about, well, if you have kind of multiple approaches, then you can get different students to kind of access this, and it accommodates their needs in one way. So you'll have one student who really prefers the online because it means they can do it any time, you know, in their own time. They don't have to like awkwardly go into kind of a counselling room, whereas other people like that personal interaction. So again, this is how can you support all the students with all of their needs. And linking with this is the barriers around getting the help that they need. And so we asked students, well, is there anything that prevented you from using a mental health service? And the top options here, I think, are what are really, really interesting. So it's not knowing how to express what's happening, feeling like there's nothing anyone can do to help, not trusting that your concerns will be handled in the right way, and feeling ashamed to explain that you have a mental health difficulty. So a lot of this is around kind of the stigma around how, you know, a lot of the aspects around mental health is that you don't want to talk about it. You feel like other people, you know, your problems aren't as kind of bigger than other people. You don't even want to be seen like to have that problem. And these are the real factors that are preventing people from accessing help. So yes, students think it's important. Yes, some students think that they are getting the support they need, but does that mean that they're actually accessing it? And there's kind of, you need to break down more of this kind of stigma to help students kind of help themselves or get kind of access to the support they need. What we do find though is students having a supportive environment. So we kind of calculated those students that feel like they have a really supportive environment. And we also kind of compared them to those students that kind of maybe feel like they don't have an unsupported environment. And we saw, well, let's compare some of these mental health outcomes and how they differ. And we found that those students of unsupportive environments are proportionally more likely to feel like they don't have any true friends at university, to currently be experiencing mental health challenges, to sort of generally be unhappy, to say that their mental health has declined, and also to just have not spoken to anyone. So there's a clear link here between how supported they feel versus kind of how they're coping with their mental health. And all of this can kind of then lead into, well, what's that transition into the workplace? So you've gone through university, you may have had a supportive or unsupportive environment, but in general, you still have the kind of same concerns that everyone has. And that is, you know, how am I going to get a job? What are my long-term job prospects? So when we ask students, about 2 in 3 students said that they feel positive about their long-term career prospects. That's actually an increase in last year, and that's actually tracks to what we see in our graduate study as well. You know, I think with 2021 being a heavily kind of furlough COVID year, there was this feeling that it was going to be really hard to get a job. And so the next year in 2022, we saw that there was definitely an increase in confidence around the job market. Doesn't mean they don't worry about getting a job though. So 58% of students that have been impacted by mental health say that they still worry about getting a job. That is more so than those that haven't, although a third of those students still worry about it. So it's still definitely something that students worry about. But what are those graduates? So, you know, you're worrying about it as a student. You've now started a job, you know, how are you kind of coping and how, you know, does that compare to those students? So what we found is 1 in 4 students said that their mental health has declined since starting work. That's still quite a lot of students. That's, you know, 20, you know, a quarter of kind of graduates. Once they've started work, it has declined. It is lower than that student population. So when that student population said that they were at university, there was proportionally more of them that said their mental health had declined. What also we find is that proportionally fewer graduates take time off work than those university students. So it was about half of university students that said they took time off. It's about a third of graduates that say they've taken time off. What is interesting though is that those graduates, about 2 in 5 say that they don't have any true friends at work, and that is actually slightly more than those university students. So university students are proportionally more likely to say they have friends, but sort of more also they're more likely to say their mental health has declined, whereas those graduates less likely to say they have true friends at work, but sort of have proportionally anyway slightly better mental health outcomes. When we asked those graduates, we were like, okay, well, you're at work now, you're in a completely different environment from university. What do you think your employer can do
to help you maintain a good mental well-being. And I think what's really interesting about the top things that come up here, they're all real practical things. So like general well-being benefits, so things like gym membership, counselling services, health insurance, healthy work-life practices. So, good kind of working hours, flexible working hours, not being emailed at weekends, things like that. An actual counselling service that you can go to and talk to someone in person, online, training for mental wellbeing staff, mental health being discussed in meetings, more than like kind of a quarter of the sample are saying these things. Half of people said they wanted practical wellbeing benefits. These are things that, they feel that can maintain a good mental wellbeing. Whereas if you look at the bottom half of that chart, less than 10% people say, employees sharing mental health stories, celebrating mental health awareness days. These are things that are general awareness, and sort of what's predominantly been done in the past is all around getting mental health awareness out there, which is great. You need to, be aware of mental health challenges to kind of help things. But I think graduates are now seeing, well, I now know about this. I am aware of mental health. I now want practical outcomes and practical things that my employer can do to help me with my mental health. So that was sort of all the report findings in a nutshell. Some kind of key takeaways, because I appreciate that's probably a lot of information, but essentially the majority of students, so 4 in 5 students, have mental health difficulties. COVID and loneliness continue to impact mental well-being. Almost all LGBTQ+ and disabled students have been impacted by mental health in some way. Exam and job concerns, affect final years more so than kind of first years. So again, thinking about different student groups, specialise in kind of different support services. Mental health support is really important to students. However, there is like stigma around mental health that is preventing them from accessing the help they need. And then also supportive environments. We know if a university has a supportive environment, we can see through our data that that students' mental health outcomes are slightly better. And those graduates prefer those kind of practical kind of actions versus the kind of awareness.